Well, thank you everybody for taking the time out of your busy schedule today to join us at our webinar. We have heard from many frontline workers like yourselves that the rise of COVID-19 exposures in schools has increased stress and anxiety and raised some concerns and questions for many families. So this issue is one of a number of growing concerns that have surfaced for those that work on the front lines of the pandemic right now. So we are here today to address some of these issues, discuss the psychosocial impact of these rising number of COVID-19 cases in schools and in our community and long-term care settings, and answer some questions and provide some resources at the end as well. So my name is Sherry. I am a registered social worker and crisis intervention specialist with the Provincial Mobile Response Team. And I am joined today by my colleague, Kathy.
Hi, I'm Kathy Dent. I do the same work that Sherry does on the team, and I too am a registered social worker in BC. Welcome.
Yeah, Kathy and I are thrilled to have Jordan Tinney, the Superintendent of the Surrey School Board, here with us to provide his knowledge and be a valuable resource for everyone during the call and especially in our Q&A section near the end. So just a few housekeeping items before we begin. During our presentation, please keep yourselves on mute if possible. If any questions or thoughts come up for you while you're listening, please feel free to use the chat box to share some of your thoughts. And during there's going to be a couple of discussion slides and a Q&A portion near the end. We welcome everybody, if you wish to do so, to unmute yourselves and participate in that way or through the chat box, whatever that you prefer. We are a very diverse group today, coming from all parts of the province. We just want to encourage everybody to take a moment to reflect upon the traditional and unceded land that we are all individually standing on today.
Thank you, Sherry. So a little bit about the mobile response team, of who Sherry and I are, and a number of colleagues. So the mobile response team is under the Provincial Health Services Authority with the support of the Ministry of Health and Ministry of Addictions and Mental Health. Was originally formed in 2017 in response to the overdose public health emergency, supporting frontline workers, first responders, and people with lived and living experience. So since COVID-19, our team mandate has expanded to support frontline healthcare workers with a focus on long-term residential and community care. So what do? We support the emotional well-being of frontline workers in several different ways. So we provide information and education on coping, stress, and self-care through workshops and presentations on site and virtually, like we're doing today. And we also can help people find or link to resources and services. We often find that frontline are very busy in their roles, and that's something that we can gladly help out with, and we do well. We offer immediate short-term individual psychosocial support through email or phone, and we just find that sometimes having one or a few conversations to share your concerns can help you maybe feel less burdened by them. We also do group support as well. These same services are provided to managers as well. And for people who are working shifts, we do have a 24/7 request and service line and email, so people can request service and we get back to you within 48 hours. Usually we get back to you probably, very shortly thereafter. And importantly as well, our services are free of cost and they are confidential. You can contact us anonymously and we don't have to record anything on our end. So that is us. So before we formally get started, just a big thank you to everyone. Our team in particular is aware of all the important and hard work you do, just given all the interactions that both Sherry and myself and other colleagues have had across BC at long-term care sites. We're aware of the challenges COVID-19 has presented not only in your work, but in other areas of your life. And we recognize that today you've taken time out of your busy schedule to be with us. And we're so glad that you've taken that time for yourself to maybe get some information that will address your concerns and maybe hopefully alleviate some of that worry. And we just want to thank you for all you do and for sharing your time today with us. So along with the concerns about school exposures that we are going to talk about very shortly, over the past 8 months, there have been additional challenges creating stress and worry for frontline healthcare workers, allied staff, support services, and managers across BC in long-term residential and community care. And I guess I don't need to tell you that, you're living it. Worry and stress, of course, from these challenges, they're realistic responses to the many demands placed upon you while working during this pandemic and dealing with uncertainty during this time. The challenges of COVID-19 on mental health and other major life areas have been shared with us, whether it's been when we've been hosting group discussions with teams virtually or in person, providing support through phone calls, or offering wellness information booth. We know how these challenges, though, impact workers do vary. For some, there's a lot of distress, and for others, the impact is less. Our intention is in sharing this information is in case you may be experiencing some distress from these challenges, and for you to know you are not alone. Also to let you know there are services and support available if you need them. So long-term residential and community care staff have voiced stress, worry, concern, fatigue resulting from, and so these are some of the themes that we've been seeing over the last 8 months, with increased workload and intensity from extra shifts possibly and staff shortage. We've been hearing a lot that oftentimes staff feel quite guilty if they refuse a shift because they just don't want to let their team members down. Stress from new policies, changing policies, extra protocols, extra roles and tasks that staff are taking on because of the staff shortages or program changes. And as well, what we're seeing probably in the last few months is that these sort of increased workload and stressed environments is contributing to some friction among some of the teams. And this seems to be due just to the fatigue that people are feeling at this point in time. So the other challenge is continuous stress exposure from ongoing multiple daily reports, updates in the news about COVID-19. Maybe it's grief and loss of residents and the way life was, or loss of relationships, missing family and friends. We're also seeing moral strain that's happening for frontline, as well as compassion fatigue. And managers have told us that they are very worried about the well-being of their staff. Another challenge is the health anxiety. So some are just worried about catching or contracting COVID-19 and transmitting it. We're seeing loneliness and isolation from restricting social circles for prolonged periods of time. People are missing family milestones. They're missing colleagues because of team changes. And we know that in some of the care sites, some programs have been suspended. And so those teams have been deployed to other teams. And so staff are missing their original teams. And as well as we certainly know from the restrictions within social circles as well, that maybe some of the things that you used to do for fun and to connect with others just aren't available to you right now because of public health orders, but because of the restrictions on you of just working in a care facility. We're also seeing feelings of uncertainty. And so a lot of people are struggling with like, what's next? What is to come? And that's causing a lot of concern. And I think part of it is that, you know, we all need to feel a certain or certainty in order to plan. And then of course, this is the big one that we're finding is less time for things we enjoy. And that's partially due to just being consumed by workload, prioritizing others, pandemic restrictions, and just worry for what is to come. So these are some of the themes that we're seeing as well. So we want to know, how have you prioritized your self-care during this challenging time? And so if you want to write something in the chat box, we'd really love to hear from you, which is what Sherry and myself and Alice, the other team member, do all the time in terms of just, listening to people and hearing what you have to say. So if you can and share some of what you're doing, that would be wonderful.
And we also find that to be able to connect with your peers who are in the same field and to share with each other not only some of our challenges, but what we're doing well for ourselves can also inspire others to prioritize themselves and their own self-care as well. I'm just looking at the chat box and let me see if there's, I'm not currently seeing anything. So I'm wondering if anybody would like to share something, or you feel free to unmute yourselves and speak directly too, if you like. All right, so we have somebody who shared with us that a way to prioritize their self-care, they like to make time for daily walks after school, after work, not after school. Yeah, thank you so much. We also hear from some of the frontline healthcare workers that before maybe they would used to take transit or bus or carpool, but if the distance is short enough, they also like to just do a little bit of walking or get off the bus a couple stops earlier and use that time to walk a little bit more, get a little bit of that physical exercise. And that has really worked in helping them with their own self-care. Also, I saw somebody here mention that biking is really how they like to prioritize their self-care. Also, listing 3 things I'm grateful for at the beginning, middle, and end of my day.
Oh, I like that too. That's really good.
Yeah, I like that the checking with yourself happens throughout the day and not just, a one time during the day, but beginning, middle, and end of the day. And I'd be curious to see if there is a shift or a pattern that happens as we go about our day and the things that we're grateful for, the things that perhaps bring us some stress. So thank you so much for sharing that. And one last one, FaceTime with my family and friends. Yeah, absolutely. In a time of limited social connection, technology has really helped to create that connection. Although we are hearing from people that there is a certain amount of Zoom and FaceTime fatigue. So I hear you and I feel you, but yeah, it still is a valuable tool to be able to feel that connection. So thank you everybody for your participation.
Great. So on the topic of self-care then, we all know it's important. And so why do we sometimes minimize the importance of it for ourselves? And if you find your self-care is hit or miss or possibly non-existent, consider the following barriers to self-care. So these are some of the other themes that we're also seeing with our work across BC as well. We know that the qualities that make us exceptional caregivers can sometimes be a barrier to our own self-care. So always prioritizing others' needs can often leave us putting our needs to the side. So thoughts or beliefs such as, I don't deserve it, or I don't need to take a break, minimize our needs for self-care. Not seeing yourself as a priority in this profession really runs the risk of leading to compassion fatigue and burnout. And I think we're kind of seeing this situation unfold a little bit across BC. And on the other hand, if you are finding you are coping well, share what's working for you with others, just like we were just doing beforehand. I think that can kind of give people ideas if they are feeling fatigued. And if you see colleagues taking care of themselves, acknowledge it and realize that maybe they've overcome one of these barriers. And noticing each other in this way can promote mutual support or a positive culture of care. So another barrier of comparing ourselves with others can minimize our own experiences. And when these comparisons surface when we're stressed or fatigued, they only leave us feeling more defeated. So thoughts sometimes of others are working hard, so should I, when we're fatigued, really serve no purpose other than making us feel worse. If this has been your experience while working during this pandemic, please take pause and consider, what would you tell a good friend if they were experiencing the same thing? Worry and concern about the uncertainty and prolonged nature of this pandemic can lead to thoughts of nothing's going to change and contribute to these feelings of hopelessness and reduced motivation to do those things that help us cope. Keeping this stress to ourselves can contribute to worry and put more strain on our mental health. We all at times experience these thoughts and can really feel defeated by them. When these thoughts are persistent, consider sharing them with someone you trust so you don't need to be facing them all alone. So, why do we talk about self-care? And I think part of this is it's important. It's because there's a cost to us eventually when we don't consider our own needs. And this situation can present as feeling constantly angry, irritable, fatigued, anxious, or depressed. We all need time to recharge our body, our mind, our soul. We are human. And we're going to come back a little bit later and we're going to talk about how you can recharge yourself. So on to you, Sherry.
Sorry, I had myself on mute. Thank you so much, Kathy, for sharing with all of us the experience of frontline workers that we have been hearing. It's been a real honor being on the front lines and supporting all of you and your colleagues during COVID-19 as you continue to take care of the elders and vulnerable community members. So, just to segue a little bit to our guests, we are delighted that Jordan is here to join us and talk more about what the schools are doing in response to the pandemic. Jordan, so we hear quite a bit in the news of exposure events happening in many of the schools in a lot of the districts here in BC. So here we are on the screen, a report from the government and from the BC Centre for Disease Control. I was wondering if you could help us put some of these numbers into context and provide us with some of your insights.
Oh, thank you very much. Just checking you can hear me okay. So I really, first of all, I want to say thank you for all that you do, and for the people on the call participating. I'm grateful to be here and thankful for the support you provide every day. It is a time more than ever to be caring for each other, for sure. To put these numbers into context, it's interesting to look at it. I looked on November 5th, this slide is from, and it says a number of exposures is 261, and it's now November 26th by my calendar. And I just looked before this call and we've had 265 exposures in Surrey alone. So when you look at this graph, just to put it in perspective, you see on the right-hand side the Fraser Health versus Vancouver Coastal and all other areas. And there's no question that Fraser Health Authority and Surrey in particular have been, the overwhelming place where exposures have occurred. And to give you some context on that, on the BC Centre for Disease Control, there's a map that breaks it down by region and like the actual health authority region. And to put it in perspective for Surrey, all of Vancouver as a whole, all of the regions in Vancouver have 3,400 cases, and Surrey has 4,300. And so it just puts in perspective just how many cases are in Surrey in particular. And, Langley on one side of us and Delta on the other both have kind of mid 400 number of cases. So when I look at these numbers, it's no surprise that there have been a number of exposures in schools, and it's no surprise that most of those exposures have been in Surrey. So I just, then I know you had some questions and I wanted to walk through, okay, so what does an exposure actually mean and what actually happens at a school whenever there is a letter? So just if you can flip to the next slide, Sherry. So what is an exposure exactly and what happens? So, excuse me. So the different protocols. So a notice of exposure, that N that you see previously, is a letter that we send home to schools to saying that someone who has tested positive with COVID has been infectious while they are on site. And it doesn't mean that there's any necessarily big need for concern in the school. It simply means that health is now beginning its tracing work. And so the exposure letters, one of the most important questions people ask right away is, well, who, where? Is it my class? Is it, my friend? Is it my teacher? That's the fundamental piece people go to right away, is they want to know. But of course, privacy is paramount, and some people openly want to share, hey, I've tested positive with COVID, just so that you know, but many people do not. And the privacy for schools has been really important because we've had, as you can imagine, children who are positive, and different views, but I know for me, I wouldn't want necessarily my child being the one saying, hey, it's me that has COVID in class, because stuff happens, kids get picked on, bullying, shaming, kids being made fun of. So the notion of privacy is really important. But if you get an exposure letter from your school, the one thing I would say is don't panic. But the other part is, as you likely know, you would hear directly from your health authority within 24 to 48 hours. So if you have any reason to be concerned, the health authority is going to follow up with you very, very quickly. So what happens with the phone calls, of course, is then contact tracing. And if there is any further need for work at the school, what you might do is those who are deemed to be close contacts by health would get a letter of self-monitoring. So that simply means, just monitor yourself for symptoms. It means you are a closer contact, the way I put it, but not so close that which would have you in the next phase, which is to be in self-isolation. So there's kind of those three levels. There is a letter that is a notice of exposure. And if you are deemed to be a contact at all, you might get a self-monitoring letter. So that just means watch yourself for the next 14 days. You don't need to do anything different. And then if you are deemed to be a close contact and at high risk, you will be told to go into isolation. And so that's what happens first and foremost. And again, for us, we've had a huge number of exposure letters, and we've learned a lot. What we've learned first and foremost is that with the over 260 notices of exposure that we've given out, we have fewer than 5 classes that have been put into self-isolation. So that is, we never want to see anyone or any class put into self-isolation, but to put it in perspective, that's basically, according to my math, kind of 2% chance that there actually will be a self-isolation. And that self-isolation, again, doesn't mean those people have COVID. It just means they're at greater risk. So one of the common questions we get, of course, is, hey, people are concerned about transmission. So only when there is transmission would we put a class into self-isolation. And again, that's happened basically 5 times out of 265. So that's the first most important lesson. The other one is, do the protocols work? Is school safe? And I would say, yes, schools are safe as anywhere. My child goes to Surrey school every single day. School's received an notice of exposure. Yep, go to school. It's really not much different for us as a family. But also, when you think about the protocols, people are saying, do we close schools? What else can you do? So I took a quick look this morning. So we have 131 schools in Surrey, and 79 of our schools have received 1 or fewer notices of exposure. So almost 80 schools with 1 or fewer, and we are now, heading into December, several months into session. We have 44 schools that have never received a letter. There's been no exposure. So when you look overall, as a school system, do we believe the protocols are working and schools are safe? Yes. Knowing that Surrey is the hotspot, and certainly Metro Vancouver and all the other districts are certainly at greater risk compared to the rest of the province. But once you get outside of this main area, the numbers of exposures are really very low. So we had a school, though, that has closed. So how did that happen? So over the period of about 3 weeks, we had one school, Cambridge Elementary, it's in the news a lot, so it's all good, which had started to have notices of exposure. They had 2 or 3 notices of exposures in 3 weeks, and they got to the place where we needed to put their class in isolation. We had put a whole class into isolation and their teacher, which is very rare. And then in the week after that, there was also another exposure, or sorry, another positive case. So when that happened, that meant that there had been transmission across cohorts, and very different, I believe, from an elder care facility where you have one case, the risk is so high, it is declared an outbreak. That's about the level of risk for COVID. But in a school, we can have cases, it's not an outbreak. An outbreak is the hopping of the virus across cohorts. And so as soon as the health authority said that that had happened, they declared an outbreak. And that was the first outbreak in British Columbia. You will have heard potentially about other schools that have closed. And the term they use for that is a functional closure. Literally, the school does not have enough staff to function, so they close. But this Cambridge has been the first time that a school has had its transmission to the extent that an outbreak was declared and the school was closed. So that's what happened. And then, so what was the result? As a result of that, we've had to close the school for 2 weeks. And we've had to ask all members of the community, staff and students, to get get tested for COVID-19. So that it turned out to be 893 people in that building. And then the entire school, community, students and staff have been in self-isolation for 2 weeks. So again, 893 people. That's just a huge impact on that community. And then they will be open again on Monday, November 30th. And we actually have a team in there today, a combination of the health authority and the school district and our partners, our union partners, in terms of reviewing the protocols in the school, looking at anything differently that we need to do for opening day. It's kind of a pre-look around what is the nature of the school, how does it operate before they do it again with students in full session. So that's what's happened with our school closure. The next, I want to think about what are some common questions we get. Of course, one of the first questions we always get is, are schools safe? And I would say, yes, they certainly are. And that doesn't mean that there isn't COVID in our schools. When we have, over 4,000 active cases in our community, there's going to be COVID in our schools. There's no question. We get lots of questions when there is an exposure about why can't I know who and if it's in my class. And people really struggle with that. And I can totally understand that. The first thing that goes through your mind when you receive a notice of exposure in your school is should I be worried? Like, is it my class, or is it my teacher? Is it my friend? One of the very common questions that we get is a real misunderstanding about if a class is put into self-isolation, why aren't the siblings put in isolation as well? Why? Because you can imagine we have a grade 5 child in a school in Cambridge. They've been sent into self-isolation. Well, they might have a sibling, a brother or sister in grade 8 that, Sullivan Heights Secondary, and why are they in school? So the issue there is, remember that the child that is put into isolation, or the staff member, they don't have COVID. They are not positive. So they're put into isolation because they're at risk. They've been deemed to be a close contact. Well, since they're in isolation, which means they're away from their siblings and they're away from their family, and they're not positive, the family is not put into isolation. So you don't self-isolate a contact of a contact. You isolate the first contact. And people really struggle with that one. But it's a common question that comes up. The other common question we get is why the different rules in the public versus schools. How under the new orders that you talked about, and this is probably the place I would say that the graph you showed about COVID-19 challenges for you in your work, and the very important work that you do. All of those resonated for me, for our teachers and our support staff and our principals and vice principals. I took a quick snapshot of it, the increased workload, the continuous stress and pressure, the health, anxiety, loneliness, isolation, uncertainty, and less time. Those are things we're dealing with our staff all the time as well. And so how we support people is really important. But some people will say, how could we possibly have an order where a child over the age of 2 would be recommended to wear a mask in public, but we send all of our elementary children to school and they're not required to wear a mask? And the reason for that, and the explanation would be around the differences between controlled environments and uncontrolled environments. Dr. Bonnie Henry would say that, schools are under strict cleaning protocols. They have protocols for movement, for cleaning your hands, how often high-touch surfaces are cleaned, health checks, and all those things. Therefore, in a controlled environment like that, masks are not recommended for elementary children. It's also they state that small children in particular, have difficulty putting masks on and off, so it increases the touching of the face. And also, children often need help with the mask, so it means that another adult needs to come and be literally right with them, touching them often to help them put on a mask. So please don't take that as Jordan being pro-mask or anti-mask. I'm just telling you what the health authority rules are. And I think there is also a lot of misunderstanding about school districts' roles with respect to the province and the provincial health officer. And I say it all the time, and I said it on emails I answered last night. Dr. Bonnie Henry sets the rules. Those are the rules. And then the provincial government follows the rules and implements the rules, and the Ministry of Education tells us what to do. So, and then we go about implementing that. So I get asked every day, Jordan, why aren't you closing schools? Why aren't you mandating masks? And I'm not trying to disassociate myself from my responsibility at all, but it's, my job is to implement the guides that are provided by the province. And absolutely, if Dr. Bonnie Henry came out tomorrow and said all elementary children should be wearing masks, that's just what I would do. Like, it's just the way it is. But I think the common questions and misunderstandings are what are the differing roles and responsibilities in education. So our school is going to close. Your crystal ball is probably as good as my crystal ball. I know at 2 o'clock today, there's a swearing in ceremony for cabinet and ministers. But I can tell you there is a very, very strong thread in government that schools are essential to the livelihood of a community and our children and families. And that there is a great social and emotional and public health cost to not having children in school. I know, and if when I look back at the clock, personally, I thought there was a little too much dialogue early around schools and a robust economy. If you're using an economic argument to keep schools open, that's maybe a different argument. But the mental health and well-being of our children and families and having a sense of normalcy in life is a huge driver in why schools are open. And to give you an example of just kind of at least my temperature check of the public on that one, right on the day when Cambridge was about to close, you think about this being a school that had I think 4 or 5 notices of exposure. You've got 1 class in isolation. You've got 2 or 3 adults in the building who are very public that they have tested positive as well. So obviously the school is at high risk. This is a school that has 760 children. And I believe on the last day of instruction, 600 students were in session. So I always feel that's an interesting temperature check, pun intended, sorry, for the public in terms of, do they have faith that schools are safe places to be and important places to be? And I would say that people also get to vote with their feet. So watching the attendance overall in the district, it's really high. So I think that's a good measure. And I think that you will see this government fight tooth and nail to keep schools open as long as they can, knowing as well that there is always public pressure and political decision making as well. So the last piece before I turn to questions, and I'm happy to answer absolutely anything you want to the best of my ability. What can we do to keep schools safe? I know it sounds sort of trite, but the basics really matter, and they matter a lot. I use the example of Cambridge. I was just on with CKNW, and they were saying, gee, Jordan, what's going to be different at that school when it opens? And I believe the protocols are largely working. So we have a school right next door to Cambridge. It's almost the identical size. It's in the same community. It's probably less than a kilometer away. They've had no exposures this year. So my piece, and back to the number of schools when I look at that have had no exposures, my question is, what is the community doing as a whole to be vigilant around COVID? Are you not having play dates? Are you not socializing? Are you not gathering? When you walk your child to school, are you wearing a mask when you come as an adult onto our premises with your child? Are you teaching them, as we are in schools, to wash their hands regularly? All of the things. Are you not carpooling to hockey games and basketball games and doing all the things that you would normally love to do? But what can we do together? Unfortunately, it's have all of us play by the rules. There's a body of work that talks about adaptive leadership versus technical leadership. And then in a snapshot, technical is really doing all the mechanics right? Like putting all of the pieces in place that you need to put in place and applying the skills and knowledge that you have to resolve the job. So you could be technically perfect, but there is another mode that is about adaptive leadership, which is realizing that the knowledge and skills you have are insufficient to do the task. So when you look at COVID, this is an adaptive problem in my mind, that you're talking about changing the behavior of every individual associated with a school. And that's just what a massive task that is to keep a school safe. So it's up to all of us. I believe the basics matter. And we can talk about putting in ventilators and masks and more hand washing stations and everything. But personally, I think we need to talk as well about each of our behaviors and all the things we do. So with that, there's some basics. And Sherry, in terms of, I welcome questions or anything else or things you want me to talk about from there.
Yeah, thank you so much, Jordan, for providing that foundation to our conversation, and certainly has helped me quite a bit in some of my understanding, as I do have 2 members of my household are currently in school right now. So yeah, it certainly was very helpful. Just giving the floor to our attendees. Does anybody have any questions for Jordan or, oh, we do.
Unusual time. And so
So we have a comment from somebody. Jordan, appreciate your time and insight on masks. I have 2 children in Surrey schools, and my wife is a teacher. Both children school virtually. Every student wears a mask at all times during class instruction, but at my wife's school, it's less rigid. And I know she wishes there were more rigor on encouraging students and parents to wear masks.
Yeah, thanks for the question. So as I said, masks is a common question. Following this session today, I'm having a session with students on masks. And I don't know if people are even aware or ever have a chance. I do not exactly weeklies, but I try to do weekly videos on COVID just as an update for the community. And recently I've been escalating this issue, just encouraging people first and foremost to follow the rules we have. Like right now in secondary schools, every student and every adult is required to wear a mask anytime that they're outside of their classroom, basically, anytime you're outside of your cohort. So when we did a survey of students, what they say is that they wear masks all the time, but that they don't practice physical distancing in the hallway or breaks and things like that. But it gets much different at elementary school. So I think what we need to do is really develop a culture of wearing masks where it is required. And then we need to have the difficult conversations about, again, all of the protocols together. You know, again, Dr. Henry's really clear on masks not being recommended for children. But it's still, I think when you're walking your child to school, if your child can't physically distance, I kind of look at all of the protocols as a package. You know, there are all these things together. And so if you can, you know, wear a mask is what I say, knowing that some people won't, and it's an individual choice. So in public schools, you're always going to see this tension. And you know, my hope is that people are indeed wearing a mask anytime they're outside of their classroom, certainly in secondary schools and for the adults as well. And one of the questions I've asked of our schools recently, we have about 14 schools that are over 600 students. And I've asked them, of those 12 of those 14 schools, again, have had 1 or 0 cases. And I've asked them, what's different about your school? Like, what are you doing in your school? And what it seems to be emerging is this modeling of the adults of wearing masks and of the staff really talking about the protocols all the time. Taking, you know, if they see children that aren't physically distancing, they talk to them. And if they are in the staff room, they're wearing a mask. They don't meet face to face as adults. They're taking every measure. So you're going to see differences school to school as long as there's a provincial mandate that says masks are not recommended in elementary, and we'll see where it goes. But in secondary, we should be pushing for compliance, and we do work with the principals on that.
Hi, Jordan, it's Kathy. And there's another question that I'll pose because I don't know if other people are thinking about this, but I'll ask away here. So why don't we take student temperatures every morning before students come into school?
Also a great question. So now one, no, like I'm a teacher, right? I'm not a doctor, but back to, if you go to the Surrey Schools website and there's a COVID page and under communications, one of the many videos there is an interview I did with Dr. Ingrid Tyler, who's the medical health officer. And we also provided a table of contents for the interview, so you can see all the questions we asked her and you can click and watch it. So please go there, it's a great resource. And so we asked this question. And again, so I'm responding in paraphrasing her. So it turns out that taking the temperature for as a health check is pretty unreliable. There are a number of things that can be done. So for example, if you have a temperature and you take Tylenol or something like that, you can knock it down, but you actually are sick. And even the thermometers themselves, they need to be calibrated. Sometimes they're inaccurate. But when you ask the medical health officers, is taking the temperature a reliable indicator that someone is positive with COVID or has symptoms as they're entering the building? I believe they would answer no, that there are other measures. But please go to the video on our Surrey School website, Dr. Ingrid Tyler.
All right, I'm just wondering if any other attendees have any questions. Please feel free to share them in the chat box or just unmute yourselves and ask away. Now, in the meantime, Jordan, I have a question. I was wondering. So I spoke to a care aide some time ago. This person worked in a long-term care, and her and I, we were having a one-to-one support session. And she was just, she also has a daughter in elementary school in a different school district. And so given the risk that she has, and many of the care aides and the nurses and frontline staff have in long-term care, and also with the added risk of children expanding their social bubble in schools, what are some things that they can do at home in order to keep each other safe? Like, can they eat together? Should they do anything in addition to their lifestyle to make sure that we keep our families and our loved ones safe?
No, it's a good question, and again, I'm in education, so I would always say start with educating yourself on what the protocols actually are. Know that who should be in your bubble, who should not be in your bubble, what you should be doing. you know, I think being outside is always difficult when you travel and you go shopping and things like that. And whether you're getting together socially or for children having play dates, you need to reevaluate a lot of those things. I mean, maybe I'll answer it this way in terms of what am I doing in my home as based on what I know. My son has one really close friend and they don't play together anymore. We just have made a decision that that between the two families, the bubble is too big. So we've just put a pause for 2 weeks here where we're not, they're not playing together anymore. So they play online, right? They can play Minecraft online and they can do things like that. I have a bottle of sanitizer on my desk, and I also have a bottle of sanitizer in the, you know, in the cup holder of my car. So anytime I go anywhere, I use sanitizer all the time. The other thing is, of course, I wear a mask anytime I'm outside of my office, not in here, but you know, as soon as my door is open, I wear a mask. Especially, it turns out, knowing what we know in schools about the free time, it's the little things where you let your guard down, going for a cup of coffee, you know, where you just, hey, you know, haven't seen you for a while. It's the informal time, so you need to remain vigilant at those times. You know, I think just reevaluating any travel, you know, my family's on Vancouver Island, so that's on the cards now, but you know, just asking yourself, is it essential for you to do the things that you normally do? Meeting people at work, if you don't have to meet face to face, don't meet. Like, there is plenty of virtual options, and it's not the best. There's no replacement for being face to face, but in the current context, in my office here, you know, we have lots of office space and we have big meeting rooms, and we choose not to meet in those meeting rooms. It sounds very odd, but we meet just down the hall. But I think knowing the protocols, limiting your bubble, washing your hands, not touching your face, watch yourself for symptoms, wear a mask whenever you're out, all of those things. So I hope that helps.
Thank you so much. Yeah, so I'm just mindful about the time. So we just have 10 more minutes left, and I just wanted to leave people with something to think about near the end. So, you know, in our conversation just now with the question that somebody had asked, it all seems like a lot of the things that are causing us stress are the things that we cannot control. You know, Jordan, you were mentioning when a family or when families receive an exposure letter, one of the first things that people can start thinking about is it in my class? Is it in my child's class? Is it in their social bubble? Like, a lot of those uncertainties is really what's stressing people out. And as Kathy had mentioned before, that we hear from frontline workers that there's been constant changes in protocols at work that is leaving people feeling very overwhelmed and burdened, and adds to a lot of confusion about what they should and should not do. And now we are faced with limitations and uncertainties in our personal lives. Like, who can we socialize with? Where can we go? You know, there are just so many things that are unknown and things that we have absolutely no control over. You know, it's so easy then to just focus on things that we cannot control and just be really sucked in and overwhelmed by all of it. You know, we hear from people all the time that they feel very powerless during the pandemic, and I'm very anxious about the unknown. And, you know, I feel that way too, a lot of the times, you know, just given our work supporting frontline workers, like which long-term care is going to have an exposure, how do we respond to that? And also in my personal life, you know, as I was sharing before, I have 2 members of my household in high school right now. And our family, we have received 2 exposure letters already since September. And every time that notice comes, there is a wave of emotion that goes on. But what's really going to help us bounce back though and move forward is to reclaim that power back and shift our attention from things that we do have control over. So, you know, things that we do have control over is our own self-care. You know, like, how are we talking to ourselves right now? Like, am I being too harsh on myself? Like, am I allowing myself to be vulnerable with myself and with others? Am I extending myself the same patience and empathy that I extend to other people that I care for? And also, things we do have control over is how do we use our spare time? Am I spending all my time, constantly reading the news or getting tangled up in debates on the internet and the comment section on certain people's beliefs about this and that and how they differ from mine? Or am I using what little time we all have right now to do something and prioritize what I actually love doing? In our discussion earlier, we had everybody share with us what you do to take care of yourself. And it sounds like what we do to take care of ourselves is it's so simple and it's so part of our everyday. A lot of time we think like self-care needs to be very grand and we need to plan a vacation somewhere, and we're grieving about the loss that we cannot travel right now. When can we travel? And how come if I do travel, will I encounter COVID on the plane? Like all those things that we cannot control, it's so easy to focus on. But, as we heard from each other, that all of these things that we love doing and bring us joy and relaxation are something so simple, like taking a walk after work, like biking, as Jordan, you were saying, like somebody else was mentioning, FaceTiming with families and friends. And we have a colleague who loves to run, and she makes sure that she gets in her run every single day, rain or shine. And, I love to garden, but there's not much gardening that's going on, but I do have an indoor plant. And so, that gives me hope, and it's something that I can control. It's a little life that I can take care of. And it really helps me to reshift my focus on what is it that I can control? What is it that we can all control in this time of so much uncertainty, both in our workplace and the long-term care, and also if we do have children or dependents in a school setting right now. So, with that said, moving to the next slide, we just wanted to leave you all with some very valuable resources in the community. If you do find yourself feeling more anxious or stressed or down than usual, or having some difficulties coping with the uncertainties, or finding yourself in that negative downward thinking pattern, there are people out there for you. So one of our partners during COVID-19 is the Care for Caregiver program. It's started by the SelfCare BC and also the Canadian Mental Health Association of British Columbia. So the Care to Speak program, we often like to think about it as our partner. MRT, our program, we support that psychosocial support in the daytime from around like 8:30ish to 5 o'clock. And then Care to Speak steps in from 5 p.m. to 9 p.m. on weekdays. So this is a confidential and free hotline staffed by volunteer healthcare workers, so one of your peers, that have volunteered their time to provide that empathetic listening ear, to be somebody that understands what you're going through, and you be able to, talk to and to unleash and unload some of that burden and some of the stress. And if you have any questions that, wasn't addressed today by Jordan, as he was mentioning, he did a question and answer with, with Dr. Ingrid Tyler, and that video is to the side. So after this webinar is over, we are going to share these links with everybody that's in attendance. And you can actually also find this video just by Googling Superintendent Message Question and Answer with Dr. Ingrid Tyler, Vimeo. That's the platform that it's on. So above that, if you are currently attending or watching from a different health authority, the Vancouver Island, some of the school districts in Vancouver Island partner with Dr. Sandra Allison, the medical health officer for Central Vancouver Island area. And they did something very similar where the superintendents from the school districts gathered questions that parents were asking and then had Dr. Allison answer them to address island health specific protocols and what's happening on the island. So these are resources that you could go to get more of your questions answered. And also if you have any emotional support needs, of course, Care for Caregiver is here for you.
And another resource for taking care of yourself, maybe, recharging your body, mind, and soul, is us, the mobile response team. And just a reminder that Alice, Sherry, and I are here for you. You can call us. through, we've got some direct lines. We also have a general email and phone line as well. But we really are here for you, and please call us. We have had a great response in terms of when people do call us, and you know, they remark how after the call that they feel so much better. So even if you're not sure, try us out. We're free, we're confidential, and yeah, so please call us. Thank you.
Yeah, thank you again, everybody, for your time. And thank you so much, Jordan, for coming onto our call. It sounds like you had a busy day of talking to everybody about something that you're so passionate about. And yeah, thank you for your time, and thank you for everybody for coming and for your participation. Take care, everybody.
Thank you. Take care.
Bye.